B of Medicare does have a premium, and this is right on your grid, just right next to it. B of Medicare this year is $144.60 for the premium. It's not free. If you're on Social Security, they're going to take this out of your check. If you're not, they're going to bill you for this quarterly. So those of you starting Medicare at 65, not on Social Security, they'll send you a 3-month bill for this, all right? And then once you start Social Security, it'll just start coming out of your check. So let's talk about Part B premiums. Just as I instructed you about Part A, I want you to know how Part B premiums are calculated. Now, we learned that Part A premiums were based upon quarters, right? How many quarters do you have? Well, Part B is based upon income. Now, the income number that Medicare is looking at is called your modified adjusted gross income. We all are familiar with adjusted gross income, and depending on how you file your taxes, that's a different line item on the tax return. But we take adjusted gross and we modify it by adding back in what is called tax-free interest income. Okay, if you're an investor in municipal bonds, you do not pay, as a general rule, federal income taxes on municipal bonds. You report those numbers, though, on your return. So what happens is they take the tax-free interest income, they add it to AGI, and that becomes the number that Medicare is going to look at to determine your Part B premium. Now notice, if I'm going to start Medicare in 2020, they're going to look back at 2018 returns. They're always looking back 2 years. So if I'm in 2020, they're going to look at 2018. 2021, they're going to look at 2019. So they always look back 2 years. And so once we are enrolled in Medicare, either we did it ourselves or we're on Social Security and we're automatically enrolled, then Medicare reports to the IRS and says, we want the modified adjusted gross income. So the IRS looks that number up and they report that number back to Medicare. And you're going to notice, if you're a single person and that modified adjusted gross is $87,000 or less, as a couple, $174,000 or less, you're going to pay this year $144.60 for your Part B premium. Now let me tell you what that number is. That number is actually 25% of what it costs Medicare to cover you. 25%, right? So that means it costs them about $580 a month to cover the average Medicare recipient. And if your income is at these numbers here or less, you pay 25%. Where's the other 75% come from? Well, it comes from Medicare. You pay 25%, and they take 75% out of the Medicare budget to cover those B items, okay? But if your income is higher than that limit, what happens? You pay more, Medicare pays less. See this? Watch. If I'm at this next level, as a couple or as a single, and my income's here, now I'm going to pay an extra amount. So as my income goes up, my cost is also going to go up. So this extra amount here, folks, is called an Irma. An Irma, it's an acronym. And we gave that to you in that sheet that is stapled together. It's the green one, so be sure you're looking at that green sheet. The Irma is an acronym that stands for Income-Related Monthly Adjusted Amount. And so the Irmas vary depending upon your income. I just actually wrote a radiologist the other day. He was at $600,000, modified adjusted gross. He and his wife are now going to pay an Irma of $318.10. So what's happening? Well, at this level, you pay 25%, Medicare pays 75%. At this level, you pay 35%, they pay 65%. At this level, it's 50-50. Right here, you pay 65%, they pay 35%. The next level, you pay 75%, they pay 25%. The next one, you pay 85%, they pay 15%. So as your income goes up, they're saying, we're just simply not going to help you as much, all right? And so this is something that some of you are going to be faced with. You're going to have these Irmas. There are times when people are making this kind of money and they're working, got good jobs, but then they retire. Their numbers have changed. And so what we have is we have this opportunity, if this is an issue where you have these Irmas, we have the ability to appeal the Irma. All right, now on that green sheet there, we showed you some of the details of appealing an Irma. You have to have what we would call a life-changing event. There's 8 of them. And so if you've had a life-changing event, either work stoppage or work reduction or death, divorce, you see the ones there. If you qualify for that, then you can appeal the Irma. In other words, you can tell them, I'm starting in 2020 and you're looking at 18, but now I've retired. So these numbers are no longer my reality. So stop looking back. And so what we can do, we can say we want you to look forward. So we can project your income for this year, 2020, or we can ask them to look at 2019 if we had retired a year earlier. But we can appeal the Irma, okay? I just wrote a couple recently. They were at $290,000 while working. This just happened, $290,000. Each of them would have an Irma of $231.40. Now notice, not only do we pay an Irma on the B of Medicare, but look at this, we pay an Irma on the D of Medicare. Now I'm going to teach you about drug plans here in just a few minutes, but the lowest cost drug plan in most markets is right around $13 to $14, okay? In this particular market where I'm speaking from today, it's $13.20. It's the lowest cost drug plan. It's all over the country in that $13 range. So let's say I'm a couple that is at $290, as this couple was, and I get on that drug plan. I'm going to have to pay an extra $50.70 for the same drug plan that someone that is at these income levels just pays the premium. So if I'm below 87 or below 174, each of us would just pay that $13 premium. But if my income's higher, then I'm going to pay the Irma on the drug plan as well. So your high income affects B as well as D. And that's why it is well worth your time if you have a life-changing event to appeal the Irma. And you work with us, we'll walk you through this whole process, okay? But this couple that was at $290 appealed the Irma, they won it. And so they were actually going to be at $125,000 moving forward. So these extra surcharges were dropped off, all right? Now, it takes about 5 minutes to fill the paperwork out, folks. That's it, 5 minutes. And we got a trip to the Social Security office. Now, when we get to the Social Security office with our Irma appeal paperwork, are we going to put it in the box? I hope not. No, we're going to the counter, right? We're going to take a seat, take a number, take our turn, and we're going to the front. And we're going to say, I'm here to appeal my Irma. Is my paperwork filled out correctly? All right, so you'll put the date in there, the life-changing event, what your projected number is going to be that you want them to look at, and they will gladly drop off the Irma. So it's well worth your time to do this, all right? Okay, so that's the way that works. And again, this happens every year. So every year they're going to go back through and have the IRS report your modified adjusted gross income, but you can use that life-changing event for a couple of years to appeal your Irma. Let's go back now to the grid, please, and let's go to medical part here, and let's talk about this outpatient side of Medicare. What's covered? First off, it's again an open access system. We have no networks at all to deal with. You can go anywhere you want that takes Medicare. Remember, Medicare Advantage plans have networks. Original Medicare A and B, no network whatsoever. Okay, go wherever you want that takes Medicare. What's covered under Part B? Everything that would be related to outpatient services. So someone goes in for labs, or they have an MRI done, or maybe cataract surgery, or some other kind of an outpatient surgery. It is the B of Medicare that's going to pay all those outpatient bills. Also covered under Medicare would be your doctors and your specialist. So you go into a doctor's office for an office visit. B pays the bills. It also will pay the docs that come to see you in the hospital. A pays the facilities, but B always pays the docs. So B is paying the ER docs. It's paying for the anesthesiologists and the surgeons and the hospitalist. So all docs are paid to the B of Medicare, all right? In addition to that, home health care. Now, you recall we had home health care on the A of Medicare. Well, why is it here? This is someone that had an outpatient surgery, and now they've gone home, and they need a little bit of follow-up for a couple weeks. So doc sends this agency approved by Medicare to take care of your home health care needs, and B is going to pay the bills for that, all right? And then we also have durable medical equipment. This would be CPAP machines. If you're on oxygen, or a person has a scooter, or a wheelchair, or a walker, all that's durable medical equipment. If a person has an external insulin pump to administer their insulin, that is called durable medical equipment. And the insulin that runs through the pump is also paid through Medicare B as well in that instance. Now, did I just say that all insulin is paid through B? No, I didn't, because it's not. Most insulin actually is paid through drug plans. Okay, but insulin that's going through the pump is paid through B of Medicare, all right? That's good news. Some of you ladies may have some bone density issues. You may be diagnosed with osteoporosis or osteopenia. More than likely you have or will take shots called Prolia. Prolia shots are typically every 6 months. You take 2 of those a year. They cost $1,200 a piece. Now, do you take Prolia shots yourself? In other words, do you administer those? And the answer is no. You go to a facility for those. Therefore, B pays the bills. That's good news for you, all right? Chemotherapy. I know there are chemotherapy pills, but most people that still take traditional chemotherapy are going to a facility to get chemotherapy treatment. And so B will pay the bills for that because it's outpatient related. All right. And then lastly, covered under this will be preventive services. So this would be someone who goes in for, their annual checkup. Medicare B is going to pay the bills for this. All right. Now, I just want to give you a real important heads up about preventive services. We have given to you in your stapled sheets there a pink sheet, and it is a list of the things that are covered. This would be a very general list of things covered by Medicare when it comes to preventive. Okay, sometimes people have a longer list because of health history or maybe certain diagnoses, but Medicare B is going to pay your preventive services. Now, here's what I want you to learn from this, though. Whenever you go on Medicare, the best way to use your preventive is when you go in to see the doctor, you say something like this: hey doc, I'm here for my preventive, I'm on Medicare now, whatever Medicare is going to pay for, that's all I want. Because sometimes we'll have people that go in for their annual and they're new on Medicare, and they'll tell the doc this. They'll say, hey doc, I want this and this and this and this and this and this, and they rattle off all these things they want done on their preventive visit. Well, doc does it. You told them to. They file the claim with Medicare, and Medicare says, we're going to pay this and this and this, but we're not going to pay all the other thises because we don't believe that's medically necessary for a preventive visit. And so what happens? All those things Medicare didn't get, you get a bill for all those items. You're responsible for those, to the tune typically $200 to $400, usually labs, right? So my advice to you is don't go in and rattle off all the thises you want done. Just say, doc, whatever Medicare is going to pay, that's what I want. Because of all the other thises that you feel like are important and doc agrees to that, those will be coded differently. They'll be given a diagnostic code and they'll be covered by Medicare. But there is no preventive code for a lot of those items, okay? So whatever Medicare pays, that's what I would have done. What happens when people first go on Medicare, they're comparing their group preventive to what they think Medicare ought to cover. That's a bad comparison. And here's the example. A lot of your group plans today will pay for a shingle shot. Okay? That's part of the preventive package. Not always, but usually. You go on Medicare, never. Medicare doesn't consider shingle shot a preventive shot. It is covered by drug plans, which are subject to deductible and subject to copay. All right? So it's not preventive. It may have been on your group plan, but it's not going to be on Medicare, covered differently. The only preventive shot that Medicare will pay is hepatitis B, pneumonia, and flu shots. That's it. All right? So you want to be sure, hey doc, whatever Medicare is going to pay, that's what I want. All right, now let's look at this package financially. We have a deductible this year of $198, $198. Now, this deductible, notice it's a calendar year deductible. And this simply means that it resets every January. So if you're starting Medicare in April, from April 1 to 12/31, this is our deductible, and it resets every January. And this year, when it reset, it moved up $13. 2 years ago, it moved up $2. So they reset every January. Sometimes it goes up a little bit, sometimes it stays the same. All right? But we have to pay this deductible, and after we have met that deductible, that's when Medicare then is an 80-20 plan. Medicare is going to pay 80, and you're going to pay 20. Now, I want to talk to you about Medicare paying their 80%. We tell all of our clients this. You want to ask two questions when you're in original Medicare. Number one, any provider you go to, you're going to ask them, do you take Medicare? Now, what's the answer to that question usually? Yes, yeah. Most take. Now, not all take, but most take. I know there's some concierge docs that don't take Medicare today. Most doctors take Medicare, but always ask if they do. Okay? And so if they say yes, then if I'm with a doctor and that doctor is recommending maybe lab work or a test, procedure, or surgery, anything doc's recommending, you're going to ask this question. Now, doc, is this going to be covered by Medicare? Find out. And so if the doctor takes Medicare and this is a covered service by Medicare, that's when Medicare pays 80%. Okay? Now, let me give you an example when Medicare will not pay. Let's say you go to a chiropractor. And by the way, I like chiropractors a lot, but the only thing covered at the chiropractor's office is the adjustment of the spine. That's it. Acupuncture or maybe some kind of a therapy or x-rays or anything beyond that adjustment, that will be 100% your responsibility. Medicare only covers the adjustment of the spine only, 80-20. That's why I'm saying we find out, do you take Medicare and is this covered? Ask those two questions. Save you a lot of trouble. All right, now, Medicare pays 80, you pay 20. Now, your part is called coinsurance. It's a percentage of the bill. Now, in the health insurance, we have two types of payments. We have copayments, which are typically a $5 copay, $50 copay, and we have coinsurance. So this is a percentage of the bill. And so you're responsible for 20%. Now, your 20%, here's the problem with it. It is totally unlimited. Sky is the limit. And unless you're on Medicare, folks, you don't have a plan like this. Because when the Affordable Care Act became law, this is March of 2010 when this happened, every plan was mandated to have a max out-of-pocket established. They had to stop somewhere. We call that a stop-loss limit. That law with ACA did not impact Medicare. Okay, there is no limit to A and there's no limit to B. And that's why I said earlier it's pretty unwise to have Medicare A and B only. There's just too much financial exposure. So this 20% never, ever stops. Okay, one more thing about Medicare A and B. Here's the way the system works. It is called a fee for service, fee for service. So what Medicare does is they take thousands of services that they are going to cover and they establish a predetermined fee. Okay, we call that the assignment amount. There's a fee that they're going to allow to be billed for that. And whatever that fee is, Medicare pays 80 and you pay 20. Now, the majority of doctors will take fee for service as payment in full, but some don't. Some will actually add to the bill. And when they add to the bill, that is called an excess charge. So you have two types of doctors that see Medicare patients. Some that take assignment, that don't add to the bill, and others that add to the bill called an excess charge. All right, so I want to explain that to you because this happens and I want you to be prepared for it. Okay, so we have two types of docs. We have an assignment doctor, and let's just give the example of a visit. Let's say we go to our cardiologist, and that's approved by Medicare fee-for-service for $100. It's on the B side of Medicare, it's outpatient, so Medicare pays $80 and you pay $20. Very clean, very simple. But let's say you go to a cardiologist that doesn't take assignment, that adds the 15% to the bill. Now we have a $115 bill. Notice Medicare, they are not going to change what they're going to pay. Their 80% is tied to the original fee for service. What has changed is what you pay. You pay 20% coinsurance and 15% excess charge. Okay, so instead of 20, you pay 35. Now, in my example, it's like, who cares? Not really worth our time talking about. I am not concerned about you seeing your cardiologist. I am concerned about you having a surgery, okay? And let's say fee-for-service surgery that you have is $10,000, approved by Medicare, okay? If that doc takes assignment, the surgeon does, Medicare pays $8, you pay $2. But if that doc doesn't take assignment, adds 15% to the bill, now you have an extra $1,500. $2,000 coinsurance and 15% excess charge. Now listen, you may have the wherewithal to write the check for $1,500, but I will guarantee you, you're going to be frustrated when you have to do that. All right, now I want you to know the probability of this happening right now is about 1 out of 10 doctors charges excess. 9 out of 10 do not. Now I have the feeling that I think over time that's going to change. Now you go to Mayo Clinic, they always do this, all right? Again, most doctors don't, but Mayo will, and there's a lot of specialists that are doing this today. And my point is, whenever that happens, you're responsible to pay for it. Medicare allows them to bill it, but it comes out of your pocket. And so people who are concerned about this will oftentimes get an insurance plan to cover their excess charges, all right? Now again, 1 out of 10 do this, but I don't know what that's going to look like in 10, 15, 20 years. You know, average life expectancy in this room is 84 for a gentleman, 87 for a lady. So many of you are going to be on Medicare 20, 25 years. And if this excess becomes an issue in the next 10, 15, 20 years, you are always responsible for it unless you have a plan that will cover excess. There's actually a couple plans that will do that. I'll tell you about those in just a minute. But plans, 2 plans today cover excess, and all the rest of them will not. So if you have one of the plans that covers it, it'll pay it. If not, it's going to be out of your pocket. All right? And so we'll talk about those plans. Now, I have finished Medicare A and B. Your grid portion there should be completed if you're taking good notes. So now let's open up and let's go to Notes, page 2. Notes, page 2. Go there, please. I've got 2 statements about A and 2 statements about B that are critical for you to know. I look forward to having you join me in the next video so that you can continue learning the ins and outs of Medicare. When you're ready for personalized advice for your situation, all you have to do is go to MedicareSchool.com in order to get in touch with us. When you get there, you'll be given the opportunity to schedule a time to talk with an Enlighten You Medicare consultant. This is a completely free service for you and there's no strings attached. We'd love to answer your questions and if it makes sense, help you choose and get enrolled in the best plans for your needs.